In this video, we will learn how to present the history of diarrhea to the examiner. This is a sample presentation. Remember that the disease and symptoms of the patient may vary, so modify your presentation according to the situation and condition of the patient. Let's start.
Mr. Arif Ali is a 36-years-old businessman. He is normotensive and non-diabetic. He is a resident of Johar Abad. The patient presented with a history of loose motions for 6 months. The disease started gradually and then progressed. Initially, when the disease started, the patient had 2 to 3 episodes of loose stools and the color was yellow at that time. But in the last 20 days, the frequency of loose stools has been increased to 4 to 6 times per day. Consistency of stool is watery type along with foul smelling. Every time stool is in a small volume. The stool contains mucus and is mixed with blood. However, the patient has no bleeding from any other side of the body. There is no history of use of any blood thinners. The patient also complains sense of incomplete evacuation. Sometimes the patient has to go to the washroom at night due to loose motions. The patient also complains of occasional abdominal pain, which is mostly in the lower abdominal region. Pain is colicky in nature. There is no relationship between loose motions with any kind of food like wheat or milk. There is no improvement in disease after fasting. The patient complains of backache for the last 2 months. This pain is dull in nature and has no radiation, and it is relieved by taking paracetamol. The patient has lost weight of 10 kilograms over a period of 6 months. There is no history of skin rash or ulcers. He gives no history of oral ulcers, itching, jaundice, and visual disturbances. Also, patient gives no history of palpitations, heat intolerance, or facial flushing. Moreover, there is no history of fever or contact with a tuberculosis patient. He has no extramarital relationship. Furthermore, the patient has no history of Hakim medication or any laxatives other than the occasional use of metronidazole and ciprofloxacin prescribed by his physician. He has past surgical history of appendectomy in the year 2010. He was transfused whole blood 6 months ago due to anemia. He has no family history of such a disease. He is a non-smoker. He is married and has 2 children. In addition, he belongs to a middle-class family.
We hope this video will help you in the clinical exam. Moreover, you can find more videos about history taking on our channel. Subscribe to our channel for the next coming videos.